Hey, what's up? My name's Justin. I'm gonna document my experience in my recovery post-op. I had a L5-S1 Microdiscectomy done, or as my surgeon calls it, a microdiscectomy. I had it done on Thursday. Today is Sunday, so this is day 3 post-op, full day post-op. Thursday was April the 12th. Today is April the 15th. So I'm just going to document kind of my experience, and hopefully this will help somebody else out in the future. I had my surgery done at Ortho Indy in Indianapolis, Indiana. That's about 2.5 hours away from where I live. So it was a long drive. My surgery was early in the morning. I had to be there at 6 a.m. So I actually went up the night before and stayed in a hotel, and then reported to the hospital the next morning. Pre-op, pre-surgery, everything went smooth. Checked in, got into my pre-surgery waiting room, met with the few nurses that they had come in, do the preliminary stuff, get the IV in, get me set and prepped for surgery. Talked about the surgery with the anesthesiologist. Everything went smooth. I was very confident going into the surgery, very happy with the staff and the facilities there at Ortho Indy. I had the herniation of my L5-S1 disc. It had been going on for about 4 months. It was around the first of the year is when it really started hurting me. I'd had a bulge previously in the same area. The bulge is on the right side. This herniation actually occurred on the left. 2 years ago, I started experiencing pain, found out that it was a bulge, and so I met with a surgeon at the time. He wasn't concerned with it whatsoever. So I did steroid injections. I did 3 rounds of steroid injections, or I guess 1 round of 3 different shots or injections, and that seemed to cure it. I did fine for the next 2 years. I did kind of preventative maintenance on myself, different stretches, different exercises to kind of prevent it from happening again and to help the pain stay away, I guess. So fast forward 2 years, I'd been doing fine until about the first of this year. I started experiencing kind of just like a discomfort. It felt like muscle tightness more so than anything. And so I wasn't real concerned with it, but as the weeks went on, as the days progressed, it got a little bit worse and a little bit worse and a little bit worse, and to the point where I was in a significant amount of pain. It originally started in like my low back to just to the left of my L5-S1 area. But then what was kind of odd was the pain started progressing down my leg. So originally it was in the low back, then it started making its way toward like the outside of the hip. And then down the hip, and then at the end where it kind of stayed and resided was in like the base of my left glute, and like the very top of the thigh, backside. And so that's where the pain kind of stayed for the next, I'd say, 3 months. First month was kind of moving around, wasn't real stable. But then I started noticing, probably within the first week, 2 weeks of having this pain, I started noticing there was like a slight tingling in my foot, my left foot. It was like the pinky toe and the outside edge were just a little bit, it was just like a slight tingling sensation, essentially. That progressed to grow on, and to the point where half of my left foot was numb. That really concerned me. After this numbness came upon, I started noticing, I woke up one morning and my left calf muscles were incredibly sore. It felt like I'd had the worst calf cramp of my life in the middle of the night, but I never experienced any pain from it. I mean, anybody knows if you wake up with a cramp in the middle of the night, it's pretty severe, or a lot of times it's severe. Wake up screaming, holding your leg or something, but I never experienced that. I just woke up the next morning and felt like that had happened. So it was kind of odd. It felt like I told some of my friends it felt like I did the most extreme leg day of my life in the gym, only focusing on my left calf. So I thought that was kind of odd. And because of that, it was really sore. So that day and The next day following, probably the couple days following it, it was really sore, so I stayed off of it. And I thought, oh, it's not really, my leg has lost a bunch of strength because it's really sore. Then once the soreness went away, I noticed my leg is still really weak, but I don't have that much soreness. And that's when I kind of put two and two together that my calf muscles were not functioning like whatsoever. I had absolutely no ability to use my left calf. If I tried to do like a stand on my toes on the left leg alone, I could just slightly get my heel up off the ground, enough to slip a credit card underneath of it maybe. So I dealt with that for a few weeks. I was traveling for my job at the time and in miserable shape, away from home, away from my doctor, on the road, living in hotels, miserable. So once I got back home, I went to my family doctor here. He put me on a couple different anti-inflammatories. I guess one anti-inflammatory and then another painkiller. So the anti-inflammatory he put me on was diclofenac. And then he also put me on tramadol in conjunction to that because he said the tramadol would be good with nerve pain. He said that was primarily to help me get through the night because I wasn't sleeping real well with the pain I had. So once I started taking the combination of those two, the numbness and the tingling and the function of my calf, that all came back. So I was ecstatic about that. And from that point on, for the next 2 months, I was pretty much on that stuff nonstop. And I had some bad days, but for the most part, my days were okay. There were days where I thought, you know, hell, I don't even need surgery. I mean, I think I'm going to be able to heal myself through this. But then I had bad days as well where I thought I don't care if they cut me open right now as long as they fix this. It's pretty miserable. So definitely a lot more good days than bad days, though, when I was on that medication combination. So I met with a surgeon at OrthoIndy. He said that he thought it would be good to go ahead and progress with surgery because things had kind of plateaued. They had gotten better. They had progressed from originally when I started having the pain and the numbness and the tingling sensation, the loss of function in my calf muscle. I'd gained all that back, so I'd started progressing. He said that in very rare situations, your body can actually repair itself and potentially heal itself from one of these situations, one of these occurrences. But he said, I don't know that you're going to be able to come back fully from this. So he said, I think it's best we go ahead and schedule the surgery. He said in 3 weeks, 3 or 4 weeks, whenever you come back and we get ready to do surgery, he said if you progress significantly, we can always cancel the surgery or hold off. He said absolutely nothing wrong with that. You're not held to having surgery if you don't want it. So I thought that was a good idea. I felt really confident. We moved forward with it. And so throughout the next couple weeks, I just continued to stay on the anti-inflammatory and the tramadol that I'd been on. Things went as they had for the last month or so. Nothing new. Didn't really progress anymore. Kind of plateaued on getting better. But then 2 weeks prior to surgery, so on March 29th, I had to discontinue all anti-inflammatory medication in preparation for surgery because anti-inflammatories will thin your blood and put you at a risk for excessive bleeding after surgery, after they cut into you. So from that point on, I was only on the tramadol and extra strength Tylenol. Extra strength or regular strength Tylenol were the only two that were acceptable by the OrthoIndy program, I guess. But they couldn't advise me on anything prescription. They could just only advise me for over-the-counter anti-inflammatories. So I got in touch with my family care physician, the one who had put me on the tramadol and the diclofenac. And he said the diclofenac, yes, you need to discontinue 2 weeks prior to surgery, as it is a strong anti-inflammatory. He said the tramadol is not an anti-inflammatory, though. He said so you can continue to take that probably up to 48 hours until your surgery, and then you need to discontinue that. So that's the plan and approach that I took. And so I went, like I said, 2 weeks without the anti-inflammatory, went on tramadol all the way up until Monday was the last day I took tramadol, and my surgery was on Thursday. And so I got it out of my system 1 day sooner than the absolute deadline, I think. I was just on Tylenol, extra strength, and I was taking a very heavy dose of that to get through the day. Dealing with a pretty significant amount of pain, considering I basically weaned myself off of all other medications that were masking the symptoms and helping me deal with it. So that was a little bit brutal for those 2 or 3 days there, that I had to be on just Tylenol alone. Tylenol helped, but nothing compared to the anti-inflammatories. So I went into surgery, as I said before. I was very confident, everything looked good going into surgery, and my surgeon said that in a lot of cases with a surgery like this, it's very routine, quick, and easy, and most patients will walk out with less pain than they walked in with, which I thought was awesome. The pain that I had wasn't extreme. It was significant, but it wasn't anything unbearable. So I thought, if I have surgery done and they go in and cut out a chunk of my spine and I walk out in less pain than I walk in with, then that's pretty impressive. So that's kind of what I expected. It's kind of what I was hoping for, I guess. And so pre-operation, everything went smooth, got in. They gave me the anesthetic. That's the last thing I remember. Then I woke up from surgery very abruptly. They inserted a breathing tube down my throat for the surgery process, and I woke up very abruptly out of the anesthetic because I couldn't breathe. And I don't mean like restricted breathing or I was having difficulty breathing. I couldn't breathe at all. So I was laying upright in this hospital bed, violently coughing and convulsing, trying to get any bit of air moving through my air pipe, my windpipe, sorry, just to be able to breathe, to catch my breath. And at the time, I heard the monitor going off like crazy. My heart monitor was beeping insanely fast. I thought, I'm going to lay here and die because I can't breathe. I've seen this shit on the movies. So finally, I got a little bit of relief. I could start breathing. I was still struggling, very restricted. I was wheezing quite a bit, trying to get air, trying to breathe. They put a nebulizer treatment on me. That helped a little bit. And so finally, as I continued to breathe, it got a little better and a little better and a little better. And finally, I was back to breathing just fine. And as soon as my breathing difficulty subsided, I just passed out. They wheeled me into the recovery room. I laid in the recovery area for the next, 3-4 hours. Sleeping on and off. The nurses would come in every once in a while and check on me. But while I was in the post-op area and my breathing had subsided, or the difficulty had subsided, once I got past that, I noticed I had extreme pain down my leg, far worse than anything I'd ever experienced beforehand with this injury. So once I got my breathing down and I was able to talk to the nurses, I told them to lay me down because I was sitting upright, which that is the worst position. If you've ever had a herniated disc in your lower back, that is the most unbearable position to be in, is sitting upright. My leg straight out in front of me is awful. And so I was dealing with the most extreme pain I'd had dealing with that issue at that point since. And so she asked me to rate my pain 1 to 10. I told her at the time it was a 7. It was probably more than that. I was really hurting. It was extreme compared to anything I'd dealt with before. So she laid me down and they gave me 2 injections of painkillers through my IV, and those were, instant. The first one, she gave it to me, asked me what my pain level was. I said maybe a 6 or a 5. And she gave me a second one and then asked me again. I said probably a 3. So those helped knock down the pain. And then they gave me a Percocet pill by mouth. Once I took that, then they wheeled me into the recovery area. So that's when I laid in there and slept on and off for the next 3 or 4 hours. They told me that in order to leave, I had to get up and walk, and I had to go pee. So they kept giving me water. The nurse would just hold it, and I'd lean over and drink it out of the straw. after sitting in there for a few hours, I was heavily drugged up on painkillers, and the anesthetic was still wearing off, so I was kind of out of it. Just touched my incision, that kind of hurts still. Yeah, I was out of it. She asked me if I wanted to get up and walk. I told her, yeah, you know, I'd try. She started to lean the back of the bed up again, and again, I had severe, severe pain going down my leg. Once again, much worse than anything I'd experienced before. So I started screaming at her to put me down, and so she laid me back down. And then I got up and stood up under my own will, which was incredibly painful as well, but better that I do it myself. And so got up, walked down to the end of the hall, made an attempt to pee, couldn't pee. Didn't really feel like I had anything in my system, considering I wasn't able to drink or eat anything after midnight, so not surprised I couldn't pee. So I did find walking. I just had a lot of pain when getting up from a laying down position, a lot of pain. So walked back to my room, laid back down, continued to sleep for the next hour or so. And the nurse told me at the time, you know, you need to pee, so make sure you're drinking a lot of water. Well, that Percocet and the pain pills they'd given me was making me very, very nauseous, very sick, very dizzy. I hadn't had anything but 1 graham cracker in my stomach for the last, at that point, probably 13, 14 hours, and a ton of pain meds. Didn't work out to a good combination there. So I continued to drink water because I knew I was going to have to pee before I could leave. I wasn't really excited about leaving because I was still in an immense amount of pain. And so during that time, my surgeon came in and talked to me about the surgery. I was kind of out of it still when talking to him, but I know he said that the surgery went smooth. He said that there was a large fraction of the disc that had been herniated, and they pulled it out in 2 pieces. He said the rest of the disc on the backside looked like it had already started repairing itself. He said, so your body's doing a great job in protecting itself. He said, I don't think you're going to have any issues. But I told him I'm in much, much more pain than I ever was beforehand. And he said, well, that's surprising. I expected you to have relief. He said 9 times out of 10, when people wake up from surgery after having microdiscectomy surgery, said they have immediate relief of the symptoms that they were having previously. I said, well, dude, that's not the case. Like, I am far, far, far worse off now than I was pre-surgery. And so he just did a little test on me, tried to lift my left leg, and it was extremely painful. I started screaming, so he put it down, lifted my right, no issue there. He said, this is kind of interesting. He said, it may just be because the nerve is irritated, considering we were digging around down in there. And he said, let me know how you progress over the next couple days. He said, there's the potential that you have re-herniated it, which I felt at the time like I had completely blown the disc out. Like, felt like I had ruptured it to the most extreme possibility. It was brutally painful. He said that he's never had a patient herniate or re-injure the disc immediately after surgery. He said, but I mean, it's definitely possible. So one thing we were concerned about is in my coughing and convulsion trying to breathe, that maybe I didn't re-herniate the disc. It was definitely at its weakest point immediately after being cut out. And so that's one thing we kind of discussed. Laid there, drank a bunch of water, got up, went to the bathroom, was able to pee this time. They're like, okay, you're good, you can go home now. But I told the nurses I was feeling very, very nauseous at this point. Pretty much trying to choke down the feeling of puking. The Percocet that they had given me was really close to wearing off, but they couldn't give me another one. If they did give me another Percocet, I'd have to wait another hour before going home, and I really didn't want to wait another hour there in the hospital. So they sent my mom went with me for the surgery. They sent my mom to the pharmacy to get the hydrocodone prescription to take home with me. They said, once he leaves here, you can give him that. We just can't administer him any more painkillers, narcotics, and let him leave immediately. So she left to go do that, and in the meantime, I continued to lay in the recovery bed in the recovery room I got up, got dressed, and just walking around the room, I was feeling incredibly nauseous. Walked over to the trash can, puked my lungs up in their trash can, and then I was having severe nerve pain and pain from the incision still. But once my mom got back, I crawled into the back seat of her car and made the most miserable 2.5 hour ride back home I've ever experienced in my life, and curled up in a ball in the back seat of her car. Awful. Constantly choking back the urge to vomit and dealing with the most miserable pain I think I've ever had, prolonged. So we got home, I immediately started puking again. Then I just lay down in bed and slept for the next few hours. Got up later that night at like 9:30, still in a very severe amount of pain, nerve pain that I expected to be gone. I was kind of led to believe I would be rid of by that point. And so the first night was not a good experience. I was up several times and a lot of pain. I really didn't want to take any more narcotics because I was so sick off the first one. But I think maybe it's just because I had a bad reaction to the Percocet, and the narcotics they sent home with me were hydrocodone, and I've had no problem taking hydrocodone in the past. So I was taking just Tylenol extra strength to knock down some of the pain. Wasn't doing a whole lot for me, but it's better than nothing. The first day after surgery, still a very significant amount of nerve pain, dealing with a lot of pain from the incision. Just, yeah, pretty miserable day. I could get up and walk, and getting up and walking, moving around made things better. But I could only walk and stand for so long before I started having nerve pain from standing or walking, so I'd lay down. Well, then I'd start getting nerve pain from laying down, so I'd get up, and then just vicious cycle of being uncomfortable constantly. That's how the first day went. Day two was better. Woke up in less pain. A noticeable difference from day one to day two when waking up. Pain levels had dropped. I was taking the hydrocodone at this point, and that was helping for the incision pain. I don't know that it was doing a whole lot for the nerve pain, and a lot of times narcotics like that won't do a whole lot for nerve pain. But the nerve pain was progressing, and that was a good sign. Through this microdiscectomy, and I should have explained this earlier, what they did and how the procedure is done, you can go on YouTube and find a video of this, is they make an incision. The incision in my back is about 1.5 inches long, maybe an inch, not very big. And once they make the incision, they take a tube, say this pin is the tube, and they insert it down into the incision they've made, and they essentially begin spreading your muscle from side to side and working this tube down into the point where they get to your spine. That way they don't damage any muscle tissue, they don't cut any muscle tissue, you don't have any excessive bleeding because of that. Once they get down into your spine, then that's as far down as they go with the tube. And then they take another tube that's slightly bigger in diameter. The first tube is like their guide tube, I think is what he called it, the surgeon. The second tube they then take and slide over the top on, if this one were slightly bigger in diameter than the first one. They slide over the top of the first one and essentially just spread the hole a little bit larger. And then they continue to do this with tube after tube after tube until they get their permanent working tube in there, I guess. So you've got a tube inserted into your back, and it's spread through an incision of 1 inch to 1.5 inches long. And that's their working tube. That's what they go in with, all their tools, and they cut it out. And so back to recovery, day two. Like I said, the incision from the pain from the incision and the nerve pain had subsided a little bit. So things were progressing, but I was still very concerned with the nerve pain I was having. I was under the impression that the nerve pain would be gone when I woke up, and it was far, far worse than anything I'd experienced before. Today is day three. Waking up today, once again, significantly better in the morning, getting out of bed than I was yesterday, and definitely the day before that. So definitely still progressing, and that's an awesome sign because I was not real optimistic after coming home and the amount of pain that I was in. I'm progressing fairly well. I think I'm getting close at this point to back to where I was pain levels before the surgery. I hope that I continue to progress after this, but that's the point that we're at now. I'd say I still have a little bit more nerve pain than when going into surgery, but the pain from the incision is doing very well. I have very, very little pain from the incision at this point, so that's awesome. I tried calling my surgeon the day after the surgery to tell him, you know, the kind of pain I was experiencing, and he said, if you continue with this kind of pain, we may have to do another MRI to see if you didn't re-herniate it. I've still gotten no call back and no direction from him on that, so that's something I'm not really happy about. The day after the surgery was Friday, so we're at Sunday now. Tomorrow's Monday. Hopefully he'll be back in office, and I'll try calling him then, giving him an update, say, hey, look, this is what I'm dealing with. Where do you want to go from here? I need some sort of direction. But yeah, that's where we're at today. Kind of wanted to document this, like I said in the beginning, to help somebody else out in the future. I hope that my nerve pain continues to progress and this goes away. But other people and other recovery stories that I've heard were pretty much, as the doctor suggested, that once they wake up from surgery, their nerve pain was gone, and that was not at all the case with me. So, like I said, something I'm really concerned about. My major concern is that if I did re-herniate the disc immediately after surgery, then they'll have to go in and cut it out again, and there's not a whole lot of disc left to cut. That L5-S1 disc is degenerating the way it is, and it had a herniation. So there's not a whole lot of material there to cut, and you can only cut so much until we get to the point where we're going to have to do a fusion. And at 25 years old, I really don't want to have an L5-S1 fusion done. I hear a lot of horror stories about them, which everybody does, although a lot of people that I know that have had a fusion, have had no issues with it. So I don't know, I think it's luck of the draw and who you are and just your situation, I guess. But that's something I'm definitely not looking forward to. I'll probably make a couple more videos, and eventually at the end I'll post them all up on YouTube, giving everybody a broad view look of my recovery and my experience and my takeaways, my do's and don'ts of this. If I can help anybody else going through the same situation, I mean, that's the whole goal. That'd be awesome. So, wrap this up. We're at 27 minutes now, 28. A lot longer than I thought I'd be talking. But overall, definitely doing a hell of a lot better than day one. I just really hope this continues to progress at the pace it is. If so, then I think I'll be good by the end of this week, and potentially getting my life back on track. So that's it, I guess. End of chapter 1.